Hi, everybody. This is Kara, Maciel, and Eric Conn. We are founding partners here of Conn, Maciel, Carey, and we are proud to be able to present this webinar. George asked us to do this for the group, and we are really happy to have our resources available to all of you as you're navigating and responding to COVID-19 in the workplace. Today's webinar, George has asked us to address some paid leave questions, as well as some other frequently asked questions that have arisen that Eric and I have been answering. A little bit about me, and then I'll let Eric introduce himself. As I said, I'm the founding partner of Conn, Maciel, Carey. I chair the Labor and Employment Practice Group. And so what I do is I counsel employers of all sizes on the myriad of issues with respect to employment, with compliance with federal and state law. I also defend employers in litigation and at the administrative level with respect to employment issues. And then to the extent that I have clients that are unionized, I advise them under their rights under collective bargaining agreement, do negotiations, and I also advise non-unionized workplaces regarding their rights under the National Labor Relations Act.
Hi, everybody. This is Eric Conn. I've done a little bit of work with some of the groups out there before on the OSHA side. I'm with Kara, founded Conn, Maciel, Carey 5 years ago. We celebrated our 5-year anniversary in September, and I chair the firm's OSHA Workplace Safety Practice Group. I have for now 20 years focused my practice essentially exclusively on workplace safety and health regulatory matters, working with employers through inspections, investigations, and enforcement actions involving OSHA and state OSHA programs, and then some of the other alphabet soup of agencies that get involved in worker safety issues. I also work proactively a lot more since we started our firm 5 years ago, proactively with employers to develop compliant safety and health programs, audit, train, and do all the fun stuff to make sure that we're in compliance and keeping our employees safe and healthy. And in this very peculiar and extraordinary time with this pandemic, it really is a time where this little firm that we started 5 years ago, now with 16 attorneys, is right in the middle of this with the labor, employment, HR related issues and worker safety and health issues. I think we're uniquely positioned to help employers navigate through this extraordinary moment. And we're delighted to have been invited by George to visit with you all today and talk about some of these issues. A lot of the questions that you probably have, we've heard and maybe heard from a lot of different employers. And so we're happy to be able to talk with you all today and share what we've learned researching those, what we've learned talking with folks at OSHA, and what we've learned talking with folks at CDC to be able to help you navigate through this. So we'll kick it over to Kara to get us started.
Okay, so as you know, on March 18th, just last week, President Trump signed the Families First Coronavirus Response Act. It's the first federal law that requires employers of a certain size to provide paid sick leave and family leave provisions. There are unpaid family leave provisions under the federal Family and Medical Leave Act, but this expands those provisions and now requires employers who are fewer than 500 employees to provide paid sick leave and paid family leave. There is a small business exemption for employers with 50 or fewer employees. That exemption will apply only to the paid family leave provisions, and that is if providing paid leave would jeopardize your business. We have not gotten any clarity or guidance from the government as to what that waiver and exemption means. The law is supposed to take effect on April 2nd, next week, and it will last and expire on December 31st, 2020. We haven't received any, as I said, any guidance yet from the Department of Labor, the Wage and Hour Division that is administering this leave. We should get some guidance hopefully soon. They said that they would try and do it before April 2nd, but I'm also hearing some grumblings that it might be after April 2nd, which leaves a lot of employers, particularly smaller employers, maybe many of you, within some uncharted territory as to how you can apply for a waiver from the paid family leave. But for now, let's go through each provision and I can explain what is required to be paid. So with respect to paid sick leave applies again to all employers, whether you have full-time and part-time, and it doesn't designate, any criteria other than that in terms of how long they will have worked for you. Really, it covers all employees regardless of how much time they've worked for you. And it allows employees to use paid sick leave for a variety of reasons. First, if they're isolated or self-isolated because of COVID-19 diagnosis. Secondly, if they are symptomatic of COVID and they need to take leave because they are getting care for symptoms or getting tested. If they've tested positive for COVID-19 and they need to comply with the orders of the state health official or their physician, that also is protected paid leave. Then also too, if you've got a family member who is symptomatic or self-isolating, that also is covered. And then finally, if you have a child whose school or daycare is closed because of the pandemic, then that, even if no one is otherwise sick in the household, the law allows you to have paid sick leave for those reasons. As I said, for full-time employees, they're entitled to paid sick leave for up to 2 weeks, 80 hours, at the employee's regular rate of pay. There's a maximum of $511 per day. For part-time employees, they're entitled to an average number of hours worked over a 2-week period. As I said, you have to compensate them at their regular rate of pay. If they are seeking sick leave for caring for a child because the school is closed, or if they're caring for a family member or other individual who is subject to a quarantine, sort of the last 2 bullet points, the 4th and 5th bullet points on the slide, then they're actually paid at a different rate. They're paid at a 2/3 of their regular rate of pay, up to a maximum of $200 per day. The law does not preempt existing paid local sick leave requirements. So if you are in a jurisdiction that already provides paid leave requirements, then you need to continue to follow that. Let's talk about the paid family leave benefits. So the second part of the bill talks about paid family leave. And what this allows is there's 12 weeks of paid family leave. The first 2 weeks, really the first 10 business days, are unpaid, but you can use other paid leave. You can use the sick leave that we just talked about before during that time if they so choose. Employees are eligible if they've worked for the employer for at least 30 calendar days. So where we didn't have eligibility requirements for the sick leave, there are at least some 30 days for the family leave before an employee is eligible. After the employee is eligible, they're compensated at their regular rate up to $200 a day. And again, you can use paid family leave to care for a child where the school or daycare is closed due to COVID. Go to the next slide, please. So we want to, address some frequently asked questions that we are getting from our clients. And one of the things that people have been confused about is, why is this a little bit different than other types of sicknesses or illnesses that people have experienced, other viruses? Well, the World Health Organization has declared COVID-19 now a pandemic. And the CDC is also recognizing that it is a pandemic. And because it is a pandemic, you need to, or you are allowed under the EEOC's guidelines. The EEOC is the federal agency that regulates disability discrimination. And because asking people questions about their health could be a medical inquiry, the EEOC has some limits about what you can do there. But when it is a pandemic, you are allowed to ask more questions than what you otherwise would be able to. You still have to maintain all information about the illness as a confidential medical record in compliance with the Americans with Disabilities Act. But if you do have an employee who calls in sick, you can ask some more detailed questions like, what symptoms are you experiencing? Are you experiencing a fever or chills or cough? If so, those are information you can ask. You can also ask if they are currently being tested for COVID, if they're waiting on the results of a test. I think that's a really important question, because you need to be able to understand how you need to respond if this person is, has potentially exposed other members of the workforce. I saw a question just come in that I thought I might ask. Why is this pandemic different than other pandemics? I'm not a healthcare professional, and I can't really describe why, other than, I think the World Health Organization has only previously declared 4 other pandemics since the, I think it was 1918 flu pandemic. And, they have certain levels of kind of how the virus spreads and the number of people that it affects and the number of deaths that it causes. And because that this virus has reached those levels and has spread globally almost to every continent other than maybe Antarctica, that is why it has reached this level, and the World Health Organization has declared it a pandemic.
Yeah, and I would just add, I mean, I get this question quite a bit, and I go back and forth and reading all the data and reading all the, listening to, podcasts and media reports and all this. It seems like there was a flip that switched when a study was completed that showed some modeling that, and I think the government sort of reacted to this study as well and took it very seriously, that the numbers here are just, if you model it out, are extraordinarily different than other significant virus pandemics that we've seen in the past, because of a combination of the severe symptoms that would cause hospitalizations rather than home care, the way that would result in overwhelming our healthcare system, which then has the result of achieving an extraordinarily higher mortality rate. If you look at this, when our healthcare system is not overtaxed, it is a mortality rate that is slightly higher than other very serious illnesses. I'm, again, not even comparing this to common cold or flu, but other significant things like SARS, swine flu, and other significant illnesses. It is a slightly higher mortality rate, but once you achieve this status of overwhelming the healthcare system, which we're seeing in Italy and early on in China, that the mortality rate is significantly higher when you find yourself in that circumstance. So if we don't take steps like you're seeing now to flatten the curve, right? That's the expression that's out there. Flattening the curve is to slow the wave of patients into the healthcare system, because if we overwhelm the healthcare system and we run out of beds and run out of ventilators and run out of doctors and nurses, then the mortality rate climbs even higher. And you're looking at numbers that have apparently shocked all of the governors and all of the other governmental officials in Washington, D.C., to the point that that's why they're taking more extreme measures in this case than in others. But again, not a medical professional, but really living and breathing this stuff, like I'm sure many of you are. That's my understanding of why this is different, why it's being handled different, and why we're seeing these shelter in place, stopping non-essential businesses, and promulgating legislation like this.
Before we go forward, I want to touch a little bit back on the paid family leave and paid sick leave requirements. I just want to emphasize that the Act requires everyone to post a notice about these requirements. The notice should be provided by the Secretary of Labor. Again, this is part of the guidance that we're waiting on from the Department of Labor. And while the Act doesn't say anything about the providing employees an electronic copy, given that so many employees are teleworking, I think it makes sense that you should find a way to email the policy. So really over the next, few days, everyone should be reviewing their policies, updating it, modifying it as appropriate, and making sure that your employees are aware of it. You can attach it to a writer to your handbook, or just simply circulate a copy via email. The Act also provides tax credits for employers who are required to pay leave under this Act. So it's going to be important that you want to be able to closely track when you're paying paid sick leave or paid family leave. Again, the paid family leave only covers leave when someone is taking leave to care for a child because the school is closed. It's not family leave for any other sick related reasons. If someone is sick or caring for a family member who is sick, that is only 2 weeks of paid sick leave, not the 12 weeks of paid family leave. Okay, let's go to the next frequently asked question. Eric, can you go to the next slide, please? Okay, another question we're getting a lot is, when may an employer take the body temperature of employees during a pandemic? Yes, you absolutely can do that. Now that it's been declared a pandemic because of the community spread, the EEOC has clarified that employers may take employees' body temperature. Whether that is practical for your business or not, or other attendant issues, that's definitely a question you'll want to think through on how you provide those measurements, how you acquire thermometers, recognizing that if it's mandated, you may have to pay employees time for waiting in line. Also be aware that some people with COVID don't have a fever. That is definitely one of the symptomatic issues, but it's not required. So something that you might want to consider. And if you do, we can provide more guidance on some practical steps you can implement if you decide to do that.
Yeah, and one of the things in particular to think about if you are going to undertake that task is the PPE that you assign to the individual who is the temperature taker. And that, becomes a big issue that you are now tasking probably a single individual to interact in close proximity with a lot of employees. And employees who are out and about in the community when they're not at work are all folks who are potential carriers of the illness. So you want to think about PPE that is required for that individual. Another way to handle this from a practical standpoint is asking employees to take their own temperature before coming to work, if they're coming to work during this pandemic. And I think Kara has either or will talk about, I think she's already talked about asking questions about symptoms. This would fit into that bucket. So asking an employee to take their own temperature and reporting symptoms and reporting temperatures and reporting symptoms they might be experiencing is something that is more permissible now that this has been declared a pandemic than otherwise under the ADA.
Another issue that's arisen is employees who are refusing to come to work out of fear of COVID, but their job duties are essential. They need to report to work. Really doesn't lend itself well to permitting telework. Is that employee eligible for leave under the Family Medical Leave Act? You should take whatever steps you need to ensure that your employees feel that they're working in a safe environment, such as extra cleaning, maybe doing reduced staffed or some sort of shift rotation, other limited interaction with coworkers. But if someone does not want to report to work because of an unrelated health condition that is ineligible for FMLA, unless they're under the care of a medical provider for their own serious health condition. So just staying home from work out of fear for contracting the virus because they might be more susceptible, either because of their age or to a different underlying health condition, generally is not an FMLA eligible condition and would not be eligible for leave under the FMLA. If they were, though, otherwise under the care of a medical provider for their own serious health condition and otherwise qualified for the FMLA, then that would be a covered reason. But just being afraid to come out, afraid to come to work, that is not something that would qualify under the FMLA.
Okay, so now we're getting into a little bit more the OSHA category here. This is a question that we were getting quite a bit in the early days of this, where there was a lot of fear, but not a lot of information about what was going on. And a lot of employees um, in work tasks and workplaces where there is no respiratory protection required, right? We don't have exposures to chemical agents or dusts or other things that would require respiratory protection. We're asking their employers for permission to voluntarily use respiratory protection in the workplace out of fear of this virus that we were starting to hear about from other parts of the world. And maybe you're, probably getting even more requests and demands for voluntary use respirators at this point. The answer to the question, do I have to provide or permit use of respirators, including those N95 masks, if an employee requests it? And the answer is no, if there is not a mandatory use respiratory protection requirement because of an agent in the workplace. And you all, I know, are working with products that perhaps you do have a requirement based on exposures to dust while cutting stone materials. If it's required because of that, then you have your mandatory respiratory protection program. If it's not required for that reason, and maybe even before this pandemic, you've had a voluntary use respiratory protection program where, for employee comfort, they wanted to wear an N95 mask during some of these tasks. If you do permit voluntary use respirators, voluntary use masks, you can do that without the full bore respiratory protection requirements of OSHA's standards. You just have to evaluate to determine that the employee can safely use a respirator, that they don't have other pulmonary or respiratory issues where use of a respirator might endanger their health. And if you're comfortable that that's not a risk, the only other thing you have to do is provide a copy of Appendix D from OSHA's respiratory protection standard. And that's just a basic one pager that shares a little bit of information about safe use of respirators. But that is purely voluntary. And that is to say that if you decide you would not like to permit voluntary use of masks in your workplace, you don't have to. And that was true before this pandemic, and it is true today, that if you have determined that it's not required to protect employees' health, that it would truly be a voluntary choice by the employee, you can decline to permit that. You certainly don't have to provide your own, and you can decline to permit someone to use their own if you wanted to. But a lot of employers are permitting it, and if they permit it, it's just that very basic requirement of providing a copy of Appendix D and ensuring it's safe to use. That is for N95 masks. If you are permitting the voluntary use of more substantial masks, a half-face, tight-fitting, elastomeric, reusable respirator, the requirements are more substantial. Even if it's voluntary use, you still have to get into fit testing, real medical evaluations, as opposed to just sort of that assessment and developing more substantial respiratory policies. So if you're only allowing voluntary use of masks, basic requirement, anything above that, a more substantial requirement. And frankly, with the extreme shortage of masks that are out there, a lot of employers are moving to more substantial masks and taking on those more substantial requirements. The last thing I'll say about this is that there is a big distinction between these N95 masks. And when I say N95, these are, they are like cloth masks, but they have a built-in filtering medium into the mask itself. It is much more substantial than the kind of surgical dental mask, which is basically just a cloth mask, which we're seeing people, sewing in homes right now to send in to healthcare providers. If you are just talking about employees are only asking to use and you're permitting for use only those non-filtering masks, a true dental mask or surgical mask, there are no requirements from OSHA at all. That is not considered a respirator. And so none of the requirements of the respiratory protection standard are implicated by that. And here's a slightly different spin on that question, which I think may be applicable to many of you on this call, is what do we do if we do have mandatory use N95 mask tasks in our workplace, not related to COVID-19, but related to the work that we do on a day-to-day basis. What if we can't obtain those masks anymore because of this big national shortage that we're seeing? OSHA has not provided any guidance to any industry other than healthcare about relaxing the requirements around respiratory protection. So if you have mandatory use respiratory protection in your workplace and you are having trouble getting hold of the respiratory protection that you've always used, OSHA has not signaled any indication that they will relax those requirements. So the answer is you must continue to provide respiratory protection. Well, it's easy to say, if you can't get the masks, what can you do? Well, here's a few options for things that we're seeing either recommended or accepted by OSHA and CDC and other employers successfully roll out. One is to extend the life of existing respiratory protection. You know, these N95 masks are disposable masks, and it is not unusual for employees to use them one time, maybe even use them one shift or even one half a shift, dispose of them, and then grab a new mask when they start the next shift or come back after lunch or whatever. We are seeing in the healthcare system now, folks extending the life of those masks by reusing them multiple times. I've even heard some hospitals are requiring them to be used for a week at a time before moving on to a different mask. So what they're doing is, you know, washing their hands carefully before they put it on, use it for whatever duration the work task takes, washing their hands very carefully before removing the masks, and then storing the mask carefully in a paper bag, not a plastic bag, but a paper bag, and then reusing it again for the next shift. And, you know, we're seeing some folks say you can use it successfully twice, 3 times. It all depends on the conditions in your workplace and whether the mask is compromised. So if you're going to do that, we highly recommend implementing an inspection protocol where educate your employees what to look for a compromised mask, looking at the parts of the mask that secure it to your face, and looking at the parts of the mask that would serve in the filtering aspect or factor of the mask, and evaluate that they are still in good condition and still usable. And you might extend your supply by doing things like that. The other thing that we're seeing is in healthcare, OSHA is permitting some alternate fit test protocols. They have not technically allowed that outside of healthcare. And the reason they're doing that is that the typical fit test method is destructive. It requires you to dispose the mask after the test. And so we think that if you embraced some of the alternate protocols that OSHA has recommended in the healthcare field for the same purpose, extending the supply of your masks, and you're doing it in a thoughtful and careful way, that you're not going to see enforcement about that. Even though technically the guidance is not for your industry, we think if you're following the same guidelines, OSHA will be reasonable about that. Other methods that if you do run out, you can't get more masks, you don't want to extend the life of the mask, is to consider those higher level masks that higher level respirators that I talked about a little bit before, understanding that it increases the rigor of your respiratory protection program, but they are more available, and they are more available because they're reusable for, in some cases, years. So you make an investment. You have to change the cartridges on a fairly regular basis, but the mask itself will last a much longer time, and you won't have these problems with shortages. So consider that, but understand that it requires more rigor in your respiratory protection program. And then the alternative is, understanding that respiratory protection is a form of PPE, and PPE is the last form of defense. It is the lowest in priority, the lowest form of protection in OSHA's preferences, and really everybody's preferences. The idea would be starting with removing the hazard, then implementing engineering controls, then administrative controls, safe work practices, and then PPE as a last measure. So if you have, mandatory respiratory protection because of exposures to, a chemical agent or dust or whatever it is above an acceptable level, consider implementing controls to reduce those levels of exposure. Enhancing your ventilation system, rotating employees. You guys know better than I do what types of controls, either from an engineering standpoint, using wet methods to reduce dust levels, things like that to reduce exposure levels so that masks or respirators are no longer necessary. So some ideas there. Injury and illness record keeping is a big issue. We're seeing lots and lots of questions around this because although OSHA, by regulation, has exempted the cold and flu from injury and illness record keeping, OSHA has explicitly stated in guidance since this outbreak began that COVID-19, cases of COVID-19 are not exempt from record keeping, although it is similar to cold and flu, and although the outbreak is as pervasive as cold and flu, and so it becomes even more difficult or very difficult to evaluate whether a contracted case occurred in the workplace or because of working conditions, just like it is for the cold and flu, it is not exempt. And we have been working on OSHA trying to get them to change that initial determination. But they seem to have doubled down on that, so we're not sure that's going to change anytime soon. So here's the situation. If you have an employee, if you're required to maintain injury and illness record keeping logs, if you are, have 10 or more employees in a industry that is not exempt from record keeping, then you have to evaluate cases when one of your employees has a confirmed case of COVID-19. It may be recordable if it's work-related. So there's a few things to consider there. First, it has to be a confirmed case. And when I say confirmed case, that means the employee has tested positive for COVID-19. Okay, this is not showing signs or symptoms. This is not a self-diagnosis. Well, I've got all the symptoms. I'm not going to the hospital because I don't want further exposure and I don't want to expose other people, but I'm certain that this is COVID-19 because I've got the fever, I've got headaches, I've got, pain in my legs, I've got all these strained respiratory issues. That's not a confirmed case. It's also not a confirmed case if a doctor says, by all indications, this is COVID-19, but you don't need invasive healthcare, so don't come in. Or you've gone in and they still say, this is a likely case of COVID-19, but we can't get you a test because we don't have a lot of tests, and you're not in one of these categories where it's, high risk patient or a known exposure that we're aware of. So we're not going to give you a test. Without a test, it can't be a confirmed case. And if it's not a confirmed case, it is not going to be recordable on your 300 log. The other big issue is determining that it is work-related. How in the heck do you figure out that one of these things is work-related? The standard is that it is more likely than not that an event or exposure in the workplace caused or contributed to the illness. And when you have community spread outside your workplace as pervasive as we are seeing this illness spread, it is, to me, a real strain to say that an employee showing up with a confirmed case is more likely than not that the exposure occurred in the workplace. And we have tested this with OSHA and pushed them and gotten some informal guidance from OSHA, and they have confirmed, look, we are not expecting to see a lot of recorded or reported cases of COVID-19 unless you are in the healthcare industry, you are in the nursing care industry, or you have a cluster in the workplace. And to me, cluster means certainly more than one case. And to me, it means more than two cases and maybe even more than three. I would say 3 or more cases where there is reason to believe that cluster got it from each other, right? 50% of your billing department, or, 75% of one of your crews all got the illness around the same time. There is, at that point, objectively a reasonable basis to conclude that at least 1 or 2 of those was more likely than not to have occurred from a work-related exposure, exposure doing their work duties, than it was just a generic community spread. So confirmed case, work-related, and then you have to meet one of the general recording criteria. So if you have someone who is self-quarantining or self-isolating because they know they were exposed to someone with the illness, well, that might be a days away treatment or days away. That is days away from work, but it must be days away from work because of an illness. So there has to be symptoms for one of those criteria to be met. So it is possible to have a recordable coronavirus case, but I think very, very unlikely in the industry that you all are in without a cluster, without like most of a crew coming down with this. The other side of this is reporting, picking up the phone and calling OSHA. I think it is even less likely that you will be required to report COVID-19 cases to OSHA for a couple of reasons. First, you undertake the exact same, and let me just start by saying this. Whereas you might be exempt from record keeping if you are a very small employer, no one is exempt from reporting. If you have an employee who is hospitalized because of a work-related illness or dies because of a work-related illness, you are required to report even if you are not required to maintain OSHA 300 logs. So this applies to everybody. But it is even less likely, I think, to have these cases arise in the industry that you guys are in. First of all, you undertake the same analysis for coverage. A, has to be a confirmed case. B, it has to be work-related. That's going to rule out almost every instance that you all will likely encounter in your workplaces. But also, you have to meet one of the reporting criteria. That means inpatient hospitalization or death. And so for inpatient hospitalization, the reason why I think there will be almost no reportable cases of COVID-19 is that the employee in a work-related exposure, known work-related exposure, you've confirmed it's more likely than not, that's what caused it. That employee needs to be admitted to the inpatient service of a hospital within 24 hours of the work-related exposure that caused the illness. And by all indications from CDC, World Health Organization, and medical experts who are, talking about this illness, there is a strong indication that symptoms do not appear, let alone severe symptoms that would result in an inpatient hospitalization. But any symptom at all is unlikely to appear until the earliest 48 hours after the employee contracts the illness. So if you're not showing any symptoms, and then the more severe symptoms that might result in hospitalization aren't showing up for 6, 7, 8, 10 days at the earliest after after anyone contracts the illness, it is going to be the extremely rare case that an employee is admitted to the inpatient service of a hospital within 24 hours of the exposure that causes the illness, the exposure in your workplace. So I would say it will be almost zero cases of reportable hospitalizations. Now, fatalities are potentially more likely to be reported. The timing for that is an employee, for a case to be reportable, the employee needs to succumb from the illness within 30 days of the work-related exposure. And we are seeing that in these very severe cases where patients are succumbing to the illness and dying, that is occurring in the realm of 3 to 6 weeks after the illness is contracted or longer. So that's right on that line of 30 days. So this is something that you'll need to evaluate if you are dealing with a work-related exposure that causes a death. That's the record keeping and reporting issues. I do encourage everybody, if you're not already, to follow our blogs. And I would say for purposes of this COVID-19 issue, follow our Employer Defense Report blog. We are putting everything, whether it is a worker safety issue, an HR-related FMLA issue, employment labor-related issue about the coronavirus. It's all there on our Employer Defense Report blog, mostly on the OSHA Defense Report as well. So you can check out both of those blogs, subscribe to them. You'll get, we're putting stuff up just about every day about, the shelter-in-place orders, the shutdowns, the new legislation, frequently asked questions. So check that out. And then hopefully the world goes back to normal one of these days, and you're thinking about ordinary risks and hazards in the workplace and not this extraordinary pandemic issue And when that happens, plan to join us for our regular monthly webinar series on the labor employment side, as well as the OSHA side. Check those out. Those are free webinars every month on hot labor employment and OSHA issues. So let's jump back now and see what questions have come in. If you have questions, find the box and type those in, and we'll try and address a bunch of those right now. And if there are others we can't get to right now, or others that you think of later, don't hesitate to reach out to us. We'll make sure that we get you our contact information. Kara, have you been tracking questions? Is there anything here?
I have a little bit, yeah. Well, let's get to that. Before we jump into the chat, there are several questions in the chat function, so thank you everybody who've been putting them in during the presentation. While Eric was conducting his portion of the presentation, I happened to check my news alert of the morning, and of course, this is an ever-changing situation, and I'm hearing that while the Department of Labor has not issued its regulations yet for the Paid Family and Medical Leave Act new law, they have released some Q&As, and some of the Q&As address some of the questions that you've been posing, one of which was raised before the call, talking about the small business exception and whether, if providing childcare related paid sick leave or paid family medical leave would jeopardize the viability of my business, how do I take advantage of that exception? And what the Department of Labor is advising is that employers should be documenting why your business with fewer than 50 employees meet the criteria set forth by the department, which of course is going to be addressed in future regulation. So for right now, don't send anything to the Department of Labor to seek an exception. They're just asking you to document why it would be jeopardizing the viability of your business as a going concern. They've got some other answers, some Q&A questions in terms of counting the hours of part-time employees and calculating pay, and whether to include overtime. So I will, after this call, circulate a link to these Q&As, and hopefully that'll be very helpful to everybody on the call. I'm just seeing them pop through now. So let's talk through some of these questions that are on the chat function. I was seeing a lot of questions, a few questions about, how does this apply to unionized environments? Certainly, if you have a collective bargaining agreement, you want to make sure that you're following the terms of the collective bargaining agreement. This law, does take effect and applies to all employers, so both unionized and non-unionized. So you want to make sure if you have other sick leave benefits in your CBA, this leave is in addition to that. So you want to closely follow the terms of your CBA, and if you have to pay for sick leave, look at your CBA, whether you're required to pay other benefits on those hours, like contributions into pension, health. If your CBA says, yes, when someone's taking sick leave, that is considered hours of work, and therefore it is considered, you have to make your regular payments for pension and other contributions, follow the terms of that. If anyone has specific questions about their CBA, I'd be happy to answer that off the call. In terms of is the 2-week paid leave specific to COVID, or would it apply for the entire year? In other words, if someone is receiving 2 weeks of paid leave now, would they be allowed to get more paid leave later? The way I'm reading the regulation right now, the law is that the sick leave is capped at 80 hours. So if once someone uses 80 hours of leave, paid sick leave, then there is no more leave available to them under this law. Even if they were to take, 40 hours this week and 40 hours next month, they would not be eligible to take paid leave in 4 months. And again, it's only paid leave for the specific reasons listed that are all relate to COVID. It wouldn't be paid. This is not paid leave for sick leave for another unrelated non-COVID sickness.
I see a couple of questions about respiratory protection. I'll tackle a couple of those while you filter through some others. A good question here. It says that we have historically allowed voluntary filtering face piece respirators following Appendix D and following the various minimal requirements. If we now are not able to get these due to the limited supply, can we compel our employees to work without them? So the answer to that is yes. If it is truly voluntary use, right, it's not required by the employer, it's not required because of exposure levels in the workplace, you are not required to allow voluntary use respiratory protection. And that does not change even if you have historically permitted it. You can rescind that permission at any time that you want. It is truly voluntary use. It is not regulatory required, even if an employee asks for it. And let's see, in that regard, there's one here that says if healthcare is permitted to relax some of the respiratory protection requirements, and everybody in the country, is being asked to donate masks to healthcare facilities, contributing to our own shortage, how can we be held by OSHA to, the continued regular level of respiratory protection requirements if healthcare is not? And so my answer is that, OSHA is, basically OSHA was directed, the Department of Labor was directed by the executive branch to help find ways to help the healthcare system. And so they are focused on the healthcare system. So they've issued guidance that says you can relax, and they're not saying you can relax your respiratory protection. They're not saying if respiratory protection is required, you don't have to use it. What they're trying to do is relax some of the requirements that would contribute to the shortage of masks. And the main thing that they've done is to say, historically, you've been required to undertake a quantitative annual fit test requirement. And the quantitative annual fit test itself is destructive and is resulting in, a waste of masks. Every employee who is in the healthcare system and undertaking this annual fit test is watching with great disappointment as they have to throw away one of these masks in short supply. So OSHA has said, you don't need to do quantitative fit testing, do qualitative instead, and you can extend the life of these in various ways. So they have said this guidance is for healthcare only. My view is, if you are doing exactly what that guidance says, even though you are not in a covered industry, you are not going to get, you're not going to face the wrath of OSHA. If you're doing it for the same reason, and certainly if you are helping to contribute to the healthcare system by donating some of your own, I think OSHA will be tolerant that you have followed that guidance, because if it is, again, good enough for one person's lungs in one industry, it's good enough for others. But the purpose of that guidance was to come to the aid of a struggling and overwhelmed healthcare system. So I'm with you. It doesn't make a lot of sense to hold other industries to a different standard. It just wasn't OSHA's intent with that guidance. Their intent was to, provide this assistance to the healthcare industry. But that's why I think that you will not face much scrutiny if you are doing the same sort of things. And that's not to say, well, look, we don't need to provide respiratory protection anymore because they've relaxed requirements. That's not what the relaxed guidance is. It's just about fit test methods and some of the other aspects of those requirements. So, it's a great question, and I see it the same way, and that's why I think that I don't encourage people to violate regulatory requirements. But if you are in dire straits, like the healthcare industry, and it is painful to throw away a good mask because of a test, consider following the guidance that OSHA has provided to healthcare. And I think you'll get some leeway from OSHA. I would expect you'll get some leeway from OSHA. And I would argue, vigorously for you that there's a feasibility defense that says, look, we have to continue to provide respiratory protection. You've given us a clear path to how we can do that effectively to maintain our supply. We're following your guidance, and otherwise it would be infeasible, and that would be a legitimate defense to a violation.
There's a question on here that says, can you ask a customer to take their temperature if in fact they stop at your place of business, or is it only for employees? The regulations from the EEOC do only apply to employees because that's the section of the Americans with Disabilities Act. that talks about, employee issues and medical inquiries of employees. So I don't know if you can ask a customer to take their temperature and whether you'd want that information, but at least the regulatory guidance only applies to employees.
Yeah, and so can we brainstorm that a little bit? If the reason why you sometimes cannot ask or most of the time cannot ask your employee to take the test is because it might violate the ADA, right? Then you don't have ADA requirements as it relates to a customer. You might have accessibility requirements, but not some of these other requirements. Do you think that would extend then to say, well, look, if I'm not prohibited by the ADA from asking them medical questions under any circumstance during a pandemic, I should also be protected from making those kinds of inquiries. Do you think that translates?
It could. Yeah. I mean, I guess the question is, are you asking all customers? You want to make sure that whatever you're doing it in a consistent basis, and you have a reasonable basis, objective evidence to take a temperature. If a customer were somehow exhibiting symptoms of an illness, while they come into your place of business, that certainly would be a reasonable objective basis. But if you were just doing it for all customers, that would be another basis. But I would be uncomfortable if you were selecting certain customers over other customers.
Great point. And in a sort of parallel kind of question, and we've addressed this for others, is can we require vendors to wear certain PPE or to wear protective material to enter our workplace, like a delivery person or a vendor? And the answer is, generally speaking, yes, right? You've been able to do that under non-pandemic circumstances. If there's potential contamination that someone can bring into your workplace, in fact, you might even be required to do that in food manufacturing, things like that. So we know that it is permissible to require somebody to wear gloves or even to wear, a surgical or dental mask to come into your workplace to make a delivery or things like that. So, it may be different, as Kara says, to get into, personal inquiries about health, but to require someone to wear a mask or gloves or something like that to come into your workplace, that is permitted.
Okay, a couple of other paid sick leave questions. Someone asked if we offer 1 week of paid sick leave and 2 weeks of paid personal time off, do we still need to offer an additional 2 weeks of paid sick leave under the federal law? The answer is yes. The federal law is new leave that is in addition to any paid leave you already provide. Some questions about unemployment. If you've got employees who are laid off or the business is shut down, and so you cannot provide any work for them and they don't have any hours, then yes, they can file for unemployment. If, on the other hand, if they are working for you and you have work available to them, but they do not want to come to work out of fear to contract the virus, that's more like a voluntary resignation. They're choosing to stay home on their own. And my understanding of the state unemployment laws is that would not make them eligible. I don't, the state unemployment laws vary by state. So you'd really have to check your particular state. And a lot of states are providing economic and other assistance, and they may be relaxing some of those eligibility requirements. So this is a fast moving environment right now. And so I would just refer to your local state agency in order to understand what the eligibility is for unemployment. But generally, if someone is laid off through no fault of their own or because the government has shut down, then yes, they are able to apply for unemployment. If they are laid off and not working, and again, not your employee, and you're not paying them anything, no hours or no benefits, they've effectively been on a temporary layoff and have been terminated, then they are not an employee for purposes of the paid sick leave or the family leave. They are not working, and so they would not be covered by that. It's only if they are an employee at the time that the request for leave is made. So just be aware of that. On the other hand, if you have employees who are laid off or on furlough, for example, or temporary layoff, and you are not paying them any hours of work, but you are paying them benefits, they are still your employees, and they are still on your active payroll, and you want to count them for purposes of meeting, whether that's your 500 threshold, whether you meet, above that or below that. So if you're on the cusp of that, just be aware of how to count your employees for that. A question about whether the wages, the sick leave, the paid sick leave and paid family leave, if you can get a tax credit or it's reimbursable by the government. You can get a tax credit against it. And again, those are going to be set forth in more detail when the regulations are made. As my understanding, it's something as it relates to next year's tax credit. You should be reimbursed for your costs for the sick leave wages if it exceeds, again, taxes. So my answer to that is, let's just wait and see what the regulations say. There's not a lot right now in clarity in the act. If a case of COVID is not confirmed, is the employee still allowed to use sick pay? Also, what would qualify as a confirmed case? So the answer to that is yes, they would still be allowed to use sick leave, because they would be under they'd be either quarantined or they're waiting a diagnosis for COVID. So they would be allowed to use that 80 hours while they're waiting for a confirmation of COVID. And once they take a test, the medical provider, he is a mandatory reporter, the healthcare provider will let the employee know if their test results have confirmed that they have COVID. So it's really, the confirmation comes from the healthcare provider. Is there also a cap on paid leave for people who need to be off to care for their children who is out of school as a result of the COVID pandemic? So that would fall under the Emergency Family and Medical Leave Expansion Act. It's 12 weeks of paid family leave. That's capped there. As I said, the first 2 weeks are not paid, but they could be paid under the Emergency Paid Sick Leave Act. So you could get paid for the first 2 weeks through the sick leave law, and then the other 10 weeks are paid under the Family Medical Leave Expansion Act, and it's capped at 12 weeks. I think those are all the questions that I have seen. Eric, do you see any others on your end?
I don't. Here's one more just came in, and we've done this perfectly timed. The first time ever we've finished on time. But one more question I see.
Should we be coding hours paid for time off differently than normal working hours? So we should have some sort of proof later for reimbursement. Absolutely, yes. We recommend that you set up a separate tracking system so that you're able to effectively record when someone is taking paid time off under this new leave law, so that later you can use that to file for a refund or reimbursement through the tax credit.
Well, excellent. I think that's all the questions that have come in. Hopefully this has been very helpful to everyone. Just a couple of things just to add. We are, our firm has set up a COVID-19 task force where we are focusing most of our attention on, keeping up to date on federal and state legislation, federal and state orders about, workplaces that are permitted to stay open and the conditions they're allowed to stay open in, and tracking, and in some instances advocating for guidance from OSHA, from CDC, and from other agencies to help our employers navigate this process. If there's a question that you've got, there's a good chance we've heard it already and maybe you've answered it already. And if not, we can help you get an answer to it. We have attorneys, more or less all over the country. We've got an office in Chicago. I know many of you are in the Midwest. We've got great labor and employment and OSHA counsel in Chicago, a hub here in Washington, D.C., attorneys out on the West Coast. So wherever you are, we can be there for you. We want to be a resource for you. So we were grateful that George invited us to come visit with you all today. And again, if you have any other questions that you think of after we hang up, we're happy to be a resource for you. We have recorded this webinar, and we will get over to George as soon as we can a copy of the recording of the webinar, a copy of the slides. Hopefully you've all seen those at least once already. We'll get you a copy all packaged together in case there's others within your organization or others in general that you think would benefit from this discussion. I would also, like I said, encourage you to get into our blog and subscribe to that, because there's a good chance that we'll be doing more programs like this on this subject, right? As major developments occur, don't be surprised if we do sort of unplanned webinars on this topic, just to keep everybody informed. So, thanks everybody for joining us today. I hope everyone is staying safe and healthy, and I hope everyone is managing the stress. Kara and I are both home with young ones, managing a law firm, managing this crisis, and managing homeschooling and our families. And I'm about as worried about being strangled by my wife and children as I am the coronavirus. So I hope everyone is doing a good job managing stress and managing all of the this sort of enormous challenge that we all face. And if there's anything we could do on the regulatory front for your business to help take some of that stress away, that's what we're here for. So thanks everybody, and we'll be in touch.
Thank you.